36-year-old nursing home staff presents to the emergency department with complaints of palpitations and chest pain for the past 2 days. She was working at the nursing home for the last year, but has been trying to get into modeling for the last 6 months and trying hard to lose weight. She's a non-smoker and occasionally drinks alcohol on weekends with friends. On examination, she appears well-nourished and is in no distress. The blood pressure is 150/84 millimeter of mercury and the pulse is 118 per minute. An ECG shows absent P waves. All other physical findings are normal. What is the probable diagnosis? So most of you got this right as well, which is great. So the diagnosis is congenital adrenal hyperplasia. So there's mainly 3 different, enzymes that you need to remember for this. So that's your 17 alpha hydroxylase, your 11 beta hydroxylase, and your 21 hydroxylase. In this particular case, it's 11 beta hydroxylase deficiency. Now, if you're kind of confused on, which one is what, if you're not able to remember all the features of it, just remember that out of the 3, okay, like I mentioned, just remember the numbers for now, that's 17, 11, and 21. All those that start with 1 present with hypertension, all those that end with 1 present with, ambiguous genitalia, specifically virilization in female, okay? Now, in this particular case, the baby is presenting with both ambiguous genitalia as well as a hypertension, okay, as well as hypertension. So, like I mentioned, starts with 1 presents with hypertension, ends with 1 presents with ambiguous genitalia. That's 1, 1. So you arrive at 11 beta hydroxylase. Okay, so that's just an easy way to arrive at the diagnosis without wasting too much time of trying to figure out, which is for what, and then you're going into detail about that. No, this is just like a quick way for you to arrive at the diagnosis. Okay, so which of the following is responsible for the neonate's hypertension? So the option is C, is an increased amount of 11-deoxycorticosterone. This is what is acted upon by 11 beta hydroxylase to carry it on to the next step. Now, the reason this particular, component 11-deoxycorticosterone causes hypertension is because it has mild mineralocorticoid activity. So it almost mimics aldosterone, okay? Though aldosterone, renin, cortisol levels are all extremely low, the fact that this mimics aldosterone is sufficient for it to present as hypertension, okay? Option A is increased concentration of sex hormones. This is what is responsible for your ambiguous genitalia, not responsible for hypertension. Rule it out. B, D, E all sort of go against hypertension because all of them present with hypotension, as in a decreased aldosterone, decreased cortisol, decreased angiotensin response, all present with hypertension. And since they're asking about hypertension, you can just very, very easily rule it out. Okay, and option C is the right one.
Thanks for watching. Please give a thumbs up and subscribe for more.